Comments from the Health Sciences panel.
Good day, everyone. I'm Peter McGuffin, Emeritus Professor of Psychiatric Genetics at the Institute of Psychiatry, Psychology and Neuroscience of King's College London. I'm also the convener of the Health Sciences panel of the RAE 2020.
I'm Stephen Holgate, Deputy Convener of the Health Sciences panel. I'm a Medical Research Council Clinical Professor of Immunopharmacology and Honorary Consultant Physician within Medicine at the University of Southampton.
In this video, we will talk about the performance of the 8 UGC-funded universities in the RAE 2020 in the field of health sciences. The Health Sciences panel was among the largest in the Hong Kong RAE 2020. We assessed 30 impact cases, 9 environment submissions, and over 2,000 research outputs submitted by 577 academic staff from 4 universities.
The panel consisted of 51 members, including the 2 of us. There were 18 local and 33 non-local members. The panel was formed to have expertise across the range of 4 units of assessment, including within health sciences. In addition, there were 7 lay members who were not primarily employed in academia who provided expertise in assessing impact submissions from the perspective of research end users.
Are the universities performing well in the RAE 2020?
The panel assessed research outputs in terms of their originality, significance, and rigor with reference to international standards. Research impacts were assessed in terms of their reach and significance, and research environments in terms of vitality, sustainability, including their contribution to the qualities of the wider disciplines or research base.
The overall quality of health sciences research in the Hong Kong universities is high. The 2 largest universities have well-established research-led medical schools and are strong in health sciences across the board. There is also clear evidence of developing strengths in the newer, smaller institutions.
There is also evidence that nursing, optometry, rehabilitation sciences, and other healthcare professions are all showing advances that compare well with research in these fields anywhere in the world, and that Chinese medicine research is utilizing state-of-the-art scientific methodologies.
Submissions in clinical medicine are particularly strong, warranting comparison with the best research-led medical schools elsewhere in the world, with several areas of outstanding success as evidenced not only by publications, but also by the impact that the research has had.
What are the strengths of the 8 UGC-funded universities?
Clinical dentistry ranks highly favorably alongside research-focused dental schools internationally and has notably improved since the RAE 2014 in the overall quality of its publications, and it warrants commendation for its environment and impacts of research.
Chinese medicine has seen important recent developments within Hong Kong, with an increasing emphasis on exploring underlying mechanisms of action in both medication-based and non-medication-based treatments, as well as increasingly using rigorous approaches to assessing efficacy. This bodes well for the future of the subject and its image in the world beyond mainland China.
Nursing, optometry, rehabilitation sciences, and other healthcare professions have also become more outward-looking since RAE 2014 and have shown an overall markedly upward trajectory in their research. Panel members who participated in both RAE 2014 and 2020 were particularly struck by improvements both in structure and strategy, and now certainly these compare well with the same areas of research in other universities internationally.
How can the universities strive for further excellence?
Continued and strengthened-based curiosity research, which supports a longer-term impact to research, would be something the panel would like to see. More global engagement, such as joint programs, would be helpful, as it could be used to benefit the environment in terms of the diversity of academic exchange.
Hong Kong researchers may consider increasing interdisciplinary work across boundaries and capitalizing on ethnic and cultural diversity of the population and the strength in medical care at the forefront of genomic and other studies.
The universities could also set up a formal infrastructure or clearinghouse that drives the systemic translation of research findings to practice through the setting up of policy and standard of practice and provision of resources for implementation and active participation in global collaborations.
We may also consider more international collaboration in research, provision of different academic tracks to allow staff to concentrate on research or teaching, and development of core research support services and facilities, including IT and statistical data analytics for individual researchers, and more exchange programs, visiting scientists, seed grants for high-risk blue skies research.
We are truly thankful to the unfailing support of our fellow panel members all along, under all the challenges posed by the COVID-19 pandemic.
Last but not least, we congratulate the Hong Kong universities for a superb performance in the RAE 2020. We look forward to further research excellence from the UGC sector.